Where Cote d'Ivoire, Guinea-Bissau, Liberia and several other countries are urgently updating their national response plans to detect a potential cross-border Ebola cases. For more on this, I'm joined by Daniel van Dalen, a country risk analyst at Signal Risk. Daniel, thank you so much for speaking to us. What is the status in the DRC and obviously surrounding countries concerning Ebola?
Hi there, yes. Good afternoon, and thanks so much for having me. So the state is, I think, a little bit different than what we saw in 2013, the outbreak in West Africa then. I think the response times have been quite incredible, especially since we saw in the DRC, following their confirmed outbreak on the 7th of February, they only have 7 confirmed cases, and I think that definitely is aided by the fact that containment measures were implemented immediately, which again was something very different than what we saw in 2013, where several months had passed before an outbreak was declared and a response was actually put in place. We've seen a similar thing in Guinea, also a very quick response time by local authorities there. My understanding is there's also very few cases, about 10, although there have been reported cases outside of the initial outbreak region. So obviously that's something to address. But at the same time, we've also had both countries receive the Ebola vaccine from the World Health Organization already. Frontline healthcare workers are being inoculated. Those deemed at high risk are being inoculated. Contact tracing is underway. Isolation centers are being erected in outbreak points. So I think the response has been quite robust from both authorities very early on.
Now take us through just how quick robust is when you talk about this, because we know that the fatality rate of Ebola is anything between 50 and 90% on certain occasions.
Absolutely. So when I say robust, I very much compare it to what we saw in 2013, where the outbreak in Guinea was reported in December 2013, and only in March was an outbreak actually declared by the Guinean state. And at that stage, obviously, it allowed to spread quite quickly, and that's why we saw cross-border infections happen at such an alarming rate, and why we saw, over a 3-year outbreak, where now you have one confirmed case, and within the space of 2-3 days, you have containment measures being implemented, you have an outbreak alert being put in. So when I mean robust, it's very quick compared to what we saw earlier. So I don't think we're seeing the same type of almost panic as we saw back then, which was where we saw many countries, they had an unknown virus. They didn't know what they were dealing with. Where now, after that outbreak, you have healthcare workers that were effectively on standby, isolation centers already having been put in place since then, World Health Organization having developed a vaccine, and that all happened in the space of a week or 2 within an outbreak being declared, versus again what we saw in 2013, where a couple of months had passed before any robust action was actually taken.
Well, obviously a key contributor to these chief efficiency, if you will, has been the release by the UN Central Emergency Response Fund of $15 million. What will this money go to?
Well, that definitely goes to, obviously, vaccine procurement, assistance, but external donors obviously play a really big role in this. So having those kind of contributions assist in contact tracing initiatives, treatment, the establishment of isolation centers, all necessary, obviously, PPE equipment that you see, obviously we're all familiar with coronavirus, establishing centers, and as I mentioned, vaccine procurement. And then obviously, if any specialists need to come in, that also facilitates that.
Daniel van Dalen, thank you so much for speaking to us, country risk analyst at Signal Risk, giving us an update on the Ebola situation in West Africa.